Meanwhile, the number of Chinese virus cases in the national capital continues to rise with each passing day. Delhi has recorded 3,390 new cases in the last 24 hours, taking the total number of infected cases to 73,780, surpassing Mumbai from the list of the worst affected city from COVID-19 or Chinese virus. 64 people have also lost their lives in the last 24 hours, and a total of 2,429 people have died so far from the infection. Meanwhile, after a bitter face-off, Lieutenant Governor Anil Baijal has reversed an order that made the assessment of Chinese virus patients at a government facility mandatory. The original order said the decision of sending a patient to a COVID care centre or home quarantine would depend on this assessment. The Kejriwal government had fought the directive tooth and nail, calling it a detention order. The Delhi Chief Minister is expected to speak shortly on the capital's fight against COVID.
This is a relationship of trust between two governments, and governments can take feedback from each other and can learn. The good thing is that now whatever has been decided is now for the common good of people, and it will reduce much of chaos and much of harassment of the people of Delhi. It will reduce the load on the health services of Delhi, and it is a good decision and we welcome it.
दिल्ली के मुख्यमंत्री अरविंद केजरीवाल जी होम आइसोलेशन पर गलत बयानी ना करें। होम आइसोलेशन की सुविधा यथावत पहले की तरह ही चल रही है। ये तो दिल्ली सरकार का काम है कि उनके हेल्थ ऑफिसर्स होम आइसोलेशन वाले लोगों के यहाँ जाएं और देखें, उनकी मेडिकल जांच हो सही तरीके से। हेल्थ ऑफिसर्स जाएं, वहाँ के लोगों की देखें घरों की स्थिति कि वो होम आइसोलेशन उनका सही ढंग से हो रहा है। ये दिल्ली सरकार का काम है।
If Delhi government needs money, Delhi government should ask the union government to give more funds and financial support. Of course, Delhi is the national capital. When cases go up, it becomes a concern for everybody, and we all should unitedly fight this.
Delhi Chief Minister Kejriwal meanwhile assured Delhiites that there is no shortage of beds now in hospitals for COVID patients.
बेड की रिक्वायरमेंट जो है अपने दिल्ली में वो अब 6000, पिछले एक हफ्ते से लगभग 6000 बेड्स की ज़रूरत है, और अभी हमारे पास दिल्ली में 13,500 बेड हमने तैयार कर रखे हैं। अस्पतालों में 13,500 बेड इस टाइम अपने तैयार हैं, उसमें से 7,500 बेड खाली हैं और केवल 6,000 बेड पे पेशेंट हैं। जब हम 5 से 6,000 टेस्ट रोज़ कर रहे थे तो 2 से 2,500 केस पॉजिटिव आते थे। अब जब 18,000 केस रोज़ कर रहे हैं तो अब 3 से 3,500 केस इतने ही बढ़े। हमने टेस्ट 3 गुने कर दिए, लेकिन पॉजिटिव केस 2 से 3,000, पहले 2,000 आते थे, अब 3,000 आने लगे, 3,500 आने लगे। तो जाहिर तौर पे मान लीजिए कल हम 1 लाख, 2 लाख, 3 लाख टेस्ट करेंगे तो केसेस थोड़े से ज़्यादा आएंगे।
Bringing in India Today's Kamaljeet Sandhu for more. Kamal, Delhi overtaking Mumbai as a city with the largest number of cases, but Chief Minister Kejriwal now assuring Delhiites that there are enough beds. He's got an ongoing fight with the Lieutenant Governor over various other rules, but now assuring the people of Delhi that things are in control and there are enough beds.
Shiv, a short while ago, we are in the Radha Swami BS in Chhatrapur. This is a 10,000 bed COVID management facility, one of the largest in the country. So in the next 24 hours, it's ready to open its door to COVID positive patients. They'll take in 2,000 in the first go and then later increase the numbers. This is being managed by the ITBP, and clearly, even as the number of spike, you're talking about almost 3,400 cases. Total infections are going up to 74,000 cases. So that eventual spike has to be factored in, and no matter what the political differences and ideologies may be, but one thing is common, at least they want better facilities for people of Delhi, and this is where both centre and state government need to really work together, and that is why under the wings of Union Home Minister, this ITBP facilities come in. We saw today it was named as the Sardar Patel COVID Management Facility, one of the largest in the world. We've been told after Wuhan, this is one of those which has that, in fact, it has cardboard boxes, disposable items, including foam and pillows being used so that when patients come in, the others could get some fresh material and don't have to reuse the cardboard boxes. So in that particular sense, it does seem that the management is being taken care of. But again, there has to be obviously feedback coming in from the general public, because earlier we saw that despite all claims by the Aam Aadmi Party government, remember there were patients who had to run from pillar to post, some being turned away by the hospital, some talking about shabby treatment in the hospital. The Supreme Court finally taking cognizance of that, and that is how Union Home Minister Amit Shah came into the picture. But now also the test continues. It's not that the facility has been arranged and everything can be okay. This is a constant fight. It has to be fought on the ground. We need frontline doctors, even students, if they have to really come in and pitch in. That's the time that Delhi really now needs to put its act together. So very clearly, we've heard different politicians speak, but now is the real challenge when the spike is peaking.
Okay, thanks very much, Kamal, for putting that into perspective. Very heartening images of arrangements there as well. We'll keep bringing those to our viewers.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.